Hello, it's Dr. Soyini Hawkins here, and I am so excited to be starting this new series. Really, I want to bring y'all into my OR. I get questions all the time about what do I see in the OR? What does anatomy look like? Like, tell us a little bit more about your day in the operating room. So I'm gonna pick some really good cases that I want to make points about, because so many times in the OR I'm like, if these women knew what was going on in their body, maybe they would come in and do something about it. And I'm all about education. Y'all know that. So today's topic is adhesions. A lot of people come, to their consultations and they're like, "Oh, Dr. Hawkins, I don't want any scar tissue." And I'm like, whoop, whoop, refocus, my dear. Scar tissue actually is not the bad word. Scarring is how our bodies heal. Naturally, our God made our tissue to scar to itself to get its strength and reform. What you want to avoid are adhesions. Adhesions are when things that are outside of that organ stick to it. So if you have a uterus after a C-section, you might have adhesions to the anterior abdominal wall, which is what we see in this here picture. Or bowel might get stuck to it, or the bladder might get stuck to it. And the biggest risk of adhesions is abdominal surgery or open surgeries where you have large incisions. So hence why I love minimally invasive approaches. I love robotic surgeries. My incisions are this small. That decreases the risk of this forming. So what we have in this picture here is here's a uterus. You see the fibroid. Obviously, she has a fibroid, and that's why I'm in here. But above that, once I got my camera in, I was like, oh, this is what we doing today? Those are adhesions. Yeah, this part right here, those are adhesions. Her uterus and the fibroid are stuck to her C-section scar. If she had had a previous open myomectomy, it could be stuck to that open myomectomy scar. Especially the longer the scar, the more size there is for it to get stuck. And what we do typically is we take down those adhesions, we get the anatomy normalized, is what I call it, and we hence move forward and get the surgery done. But the problem with adhesions, and the reason that sometimes surgeons don't like taking care of adhesions, because adhesions can beget more adhesions. It's still surgery. So minimizing the incision, minimizing the scar helps minimize these type of risks. So I'm a super big fan of robotic procedures, robotic myomectomies, robotic hysterectomies, robotic endometriosis resection is really the only way to take care of endometriosis, honestly, is doing it laparoscopically. Even straight stick laparoscopy. Those are small incisions. You just want your incisions to be as small as possible to get the fine work done. So that is my tidbit on my surgical adventures today. Stay tuned for more. And y'all give me a shout out, because this is my first overlay and I think I killed it. As the young people say. I ain't young, but we trying. All right, take care, y'all. Bye.